We propose a three-stage visualization system for evaluation of real and simulated minimally invasive cancer treatment. In contrast to organ resection, minimally invasive cancer treatment locally destroys cancerous tissue. Interventional radiologists insert energy-emitting probes into the tumor. It is crucial to destroy the tumor as well as a safety margin of healthy tissue around it. Nowadays, modern hardware enables fast simulation of treatment for estimating the outcome of a real intervention. This allows for pre-interventional exploration of the parameter space and for optimized treatment and avoiding tumor recurrence. Here, we show a typical evaluation situation from the clinical routine. The tumor, shown as red outline, was treated with a heat-inducing probe. This results in the blue outline, also called lesion, which bounds the area of destroyed tissue. The current clinical practice employs very simplistic tools for evaluation of the outcome. Both for real and simulated treatment, doctors can only use basic measurement tools, such as rulers, for evaluating success. This manual procedure is not only inaccurate, but also time-consuming. In the first stage, our technique completely removes the need for manual measurements. We color-code the categorized distance between tumor and lesion into a thick rim attached to the lesion outline. In this case, the safety margin is supposed to be 5 mm. We highlight critical segments which are definitely too close to the tumor in blue, whereas orange denotes regions close to the requested margin. When the user zooms in for detail analysis, we break up the rim into a bar chart representation and unblock the view on the underlying patient data. Using this approach, the user can easily evaluate treatment success by simply scrolling through a single slice deck once. In case the result of simulation does not conform to required quality criteria, the user can start an analysis in stage 2. Here, the user can add one scalar field from simulation to the visualization. We exploit a highly configurable isocontour-based color coding approach. One possible configuration provides an overview mode which equally subdivides the data into multiple ranges. We do not only encode the ISO value, but also provide information about the steepness of the gradient around the ISO contour. We fade out the opacity of the representation based on the value range of the desired contour. Thereby, ISO values embedded within a low gradient result in a wider contour in our visualization. If the user is particularly interested in specific ranges, we support modification of single contours. For example, the user might be interested in the ISO contour of 373 Kelvin, the temperature at which water starts cooking. Many factors influence the result of minimally invasive cancer treatment. For analyzing the interdependence of variables in the simulation, we encourage parameter space exploration by using bivariate visualization. In the third stage of our method, the user can add a second field from the simulation and analyze possible dependencies. We exploit structural elements for easy distinguishing of both scalar fields. The user can customize the appearance by picking the desired category borders and assigning a semi-transparent texture to it. Similar to the distance evaluation, we visualize the categories along the resulting ISO contours. We perform the formal evaluation with medical doctors in which we highlight issues with manual measurements. Additionally, we conducted structured interviews which show a preference of our evaluation method compared to the current clinical practice.